If you're over 65, the next time you see your doctor could be a turning point in your health, but only if you ask the right questions. Before we dive in, I need a quick favor from you. Take a moment to comment below. Where are you watching from? Drop your city and state, and tell us your age group. Are you in your 60s, 70s, or 80s? This really helps us create better content for our community. Here's something most seniors don't realize. Your doctor has just 15 to 20 minutes with you, and they're often focused on immediate concerns or routine checks. They might not volunteer information about your biggest health risks, medication interactions, or preventive measures that could keep you healthier longer. Quick tip before we continue. Pause this video and grab a pen and paper. You'll want to write down these 7 questions along with any personal concerns you have, so you don't forget them during your next appointment. These 7 questions are designed to unlock the most important information your doctor has about your health. Information that could prevent serious problems, help you stay independent longer, and ensure you're getting the best possible care. If you find this information valuable as we go through it, please hit that like button. It helps more seniors discover these important questions before their next appointment. Each question we'll cover today is based on what geriatricians, doctors who specialize in caring for older adults, say are the most critical areas that seniors often don't discuss with their physicians. Taking notes during this video will help you become a proactive partner in your healthcare, instead of just a passive recipient of care. Your health is your most valuable asset. These questions will help you protect it. The first question you must ask is, what are my biggest health risks based on my age, family history, and lifestyle? Write this down now. What are my biggest health risks based on my age, family history, and lifestyle? This question is crucial because it shifts the conversation from reactive to proactive care. Instead of just treating problems that already exist, you're asking your doctor to help prevent future ones. Your doctor should consider several factors when answering this question. Your family history might put you at higher risk for heart disease, diabetes, or certain cancers. Your lifestyle, including diet, exercise, and habits, affects your risk for conditions like stroke, osteoporosis, or cognitive decline. Here's where your location matters. Comment below with your state and age, and we'll share region-specific health risks that seniors in your area should watch for. Most importantly, this question helps your doctor create a personalized prevention plan for you. For example, if you're at high risk for heart disease, they might recommend more frequent cardiac screenings, specific dietary changes, or medications to prevent problems before they start. Don't accept vague answers like, well, at your age, anything could happen. Press for specifics. Ask follow-up questions like, based on my test results and health history, what should I be most concerned about? Or what can I do right now to reduce my biggest risks? This question also opens the door to discussions about genetic testing, lifestyle modifications, and specialized screenings you might need. Some seniors discover they need bone density tests, cardiac stress tests, or cancer screenings they weren't aware of. Remember, prevention is always easier and less expensive than treatment. This single question could help you avoid serious health problems down the road. Question number 2 is absolutely critical. Are all my medications still necessary, and how do they interact with each other? Pause here and write down this exact question. Are all my medications still necessary, and how do they interact with each other? This question could literally save your life. Medication-related problems cause over 125,000 deaths annually in the United States, with seniors being particularly vulnerable due to multiple prescriptions and age-related changes in how the body processes drugs. Many seniors take what's called a prescribing cascade, where one medication causes side effects that are treated with another medication, which causes more side effects, leading to even more medications. Before you know it, you're taking pills to counteract the side effects of other pills. If medication management is a challenge for you, hit that like button and share this video with someone who needs to hear this information. Here's what to bring to this conversation: a complete list of everything you take, including prescription medications, over-the-counter drugs, vitamins, supplements, and herbal remedies. Many seniors forget to mention their daily multivitamin or that fish oil supplement, but these can interact with prescription medications. Ask your doctor specifically, can any of these be discontinued safely? And are any of these causing side effects I might not recognize? Sometimes what you think is a sign of aging, like dizziness, confusion, or fatigue, is actually a medication side effect. Also ask about timing. Should any of these be taken at different times to avoid interactions? Some medications work better when taken apart from others, and some should be taken with food while others work better on an empty stomach. Add this to your notes. Ask about a medication review with a pharmacist if you use multiple pharmacies. Question 3 is, what screenings and tests should I be getting at my age and how often? Write this down. What screenings and tests should I be getting at my age and how often? This is where many seniors miss opportunities for early detection that could save their lives. Screening guidelines change as you age, and what you needed at 50 might be different from what you need at 70 or 80. Some seniors think they're too old for certain screenings, but that's rarely true. Others continue getting screenings they no longer need. Your doctor should help you navigate this based on your individual health status and life expectancy. Quick engagement question. What's the one screening or test you've been putting off? Comment below. You might motivate someone else to finally schedule theirs. Key screenings to discuss include colonoscopies, usually until age 75 but depends on your health, mammograms and breast exams, bone density tests for osteoporosis, eye exams for glaucoma and macular degeneration, and skin cancer checks. Add these to your personal notes. Ask about lung cancer screening if you're a current or former smoker, hepatitis C testing for certain birth years, and updated cervical cancer screening guidelines. Ask specifically, based on my health and family history, are there any screenings I should be getting that we haven't discussed? And are there any I can stop getting safely? Also inquire about frequency. How often should I be getting these tests? Some screenings can be done less frequently as you age if previous results were normal. Write down this follow-up question. What symptoms should prompt me to get screened earlier than scheduled? This question ensures you're not missing important early detection opportunities, while also avoiding unnecessary tests. Question 4 could be the most important for your quality of life. How can I maintain my independence and prevent falls? Make sure you write this down. How can I maintain my independence and prevent falls? Falls are a leading cause of serious injury and loss of independence for seniors. 1 in 4 adults over 65 falls each year, and many never fully recover their previous level of function. But falls are largely preventable with the right strategies. Your doctor should assess your fall risk by looking at your medications. Some increase fall risk, your vision and hearing, your balance and strength, and any chronic conditions that might affect your stability. If staying independent is important to you, and I know it is, please share this video with a friend or family member. Everyone deserves to know how to protect their independence. Ask your doctor, what exercises should I be doing to maintain my strength and balance? The answer might include specific physical therapy exercises, Tai Chi, or strength training programs designed for seniors. Add to your notes. Should I have a physical therapist evaluate my home for fall hazards? They can identify problems like loose rugs, poor lighting, or lack of grab bars that you might not notice. Address vision and hearing. How often should I have my eyes and hearing checked? Poor vision and hearing significantly increase fall risk, but these problems are often very treatable. Review your medications. Are any of my medications increasing my fall risk? Some blood pressure medications, sleep aids, and even some pain relievers can affect balance and coordination. Write down this nutrition question. Am I getting enough vitamin D and calcium for bone health? Strong bones are your insurance policy against serious injury if you do fall. Question 5 could save your life. What symptoms should I never ignore at my age? Please pause and write down. What symptoms should I never ignore at my age? Many seniors dismiss serious symptoms as just part of getting older, when they're actually warning signs of treatable conditions. Knowing which symptoms require immediate attention versus which can wait for your next appointment is crucial. Your doctor should give you a personalized list based on your health conditions and risk factors. Someone with diabetes needs to watch for different warning signs than someone with heart disease. Important question for our community. What symptom did you almost ignore that turned out to be serious? Share in the comments. Your experience could help someone else. General red flag symptoms that no senior should ignore include sudden severe headache unlike any you've had before, sudden confusion or difficulty speaking, chest pain or pressure, sudden shortness of breath, sudden weakness or numbness on one side of your body, and severe abdominal pain. Add these personal questions to your notes. Given my health conditions, what specific symptoms should send me to the emergency room versus calling your office? And what changes in my usual symptoms should concern me? If you normally have some shortness of breath with activity, how much worse should it get before you worry? If you have chronic pain, what type of pain change signals a problem? Get clarity on timing. Which symptoms need immediate attention versus which can wait until morning or your next available appointment? Write this down. When should I call 911 versus when should I call your office or go to urgent care? Having this roadmap before you need it can save precious time in an emergency and help you avoid unnecessary panic over normal age-related changes. Question 6 is about quality of life. How will this treatment affect my quality of life and daily activities? Make sure to write down. How will this treatment affect my quality of life and daily activities? This question is crucial because the best medical treatment isn't always the best choice for you personally. A treatment that extends life but leaves you unable to do the things you love might not align with your values and goals. Your doctor needs to understand what matters most to you. Is it living as long as possible? Staying mentally sharp? Maintaining your independence? Being able to travel or spend time with grandchildren? Your priorities should guide treatment decisions. Here's where we'd love to hear from you. Comment your age and what matters most to you in your daily life. Understanding our community's priorities helps us create better content for you. When your doctor recommends any treatment, whether it's a new medication, surgery, or therapy, ask specific questions. How will this affect my energy level? Will I still be able to drive? What will recovery look like at my age? Add these to your notes. What would happen if I chose not to do this treatment? And are there less intensive alternatives that might work for me? Sometimes the risks of not treating are significant, but other times you might choose comfort over aggressive intervention. There might be lifestyle changes, less aggressive medications, or alternative approaches that achieve your goals with fewer side effects. Don't forget to ask about timing. Do I need to decide right now, or can I take time to think about it? Most medical decisions don't require immediate answers, and taking time to consider your options, possibly discussing them with family, often leads to better decisions. Question 7 addresses what many seniors worry about but rarely discuss. What are my options if my health declines? Please write this important question down. What are my options if my health declines? This isn't a morbid question. It's a practical one that helps you maintain control over your care even if your health changes. Having these conversations while you're healthy and thinking clearly ensures your wishes are known and respected. Ask your doctor, what would care look like if I developed dementia, had a severe stroke, or became unable to care for myself? Understanding your options helps you make informed decisions about advance directives, long-term care insurance, and family planning. This topic might feel heavy, but planning ahead gives you power and peace of mind. If this resonates with you, please share this video with someone who needs to have these conversations too. Add to your notes. Should I have a living will and healthcare power of attorney? Your doctor can explain what these documents mean and help you think through scenarios you might not have considered. Ask about palliative care. At what point might palliative care be appropriate for me? Palliative care focuses on comfort and quality of life and can be appropriate at any stage of illness, not just at the end of life. Write down. What are the different levels of care available if I need help? Understanding the difference between home care, assisted living, memory care, and skilled nursing helps you plan financially and emotionally. Address family concerns. How can I help my family understand my wishes? Your doctor might recommend family meetings or counseling to help everyone understand and accept your care preferences. This question ensures you maintain dignity and control over your care regardless of what the future holds. Now that you know the 7 critical questions, let's talk about how to use your notes effectively to get the most out of every doctor's appointment. First, take a moment now to review the questions you've written down. Add any personal concerns or symptoms you've noticed since your last visit. Your notes should be a starting point, not a limitation. Before your appointment, review your notes and think about which questions are most relevant to your current health situation. You don't need to ask all 7 questions at every visit, but having them available ensures you don't miss important topics. Before we continue, if these note-taking tips will be helpful for you, show your support by hitting that like button and commenting your city, state, and age group. We love knowing where our community is watching from. During your appointment, don't hesitate to take out your notes. Good doctors appreciate prepared patients. If your doctor seems rushed, say, I have a few important questions that will help me take better care of my health. Can we go through them? Take notes directly on your paper or bring someone with you to help remember the answers. Medical appointments can be overwhelming, and it's easy to forget important information once you leave. Write down this tip. Ask for clarification if you don't understand something completely. It's better to extend your appointment slightly than to leave confused about important health information. After your appointment, review your notes and follow up on any unclear answers. If you didn't get complete answers to important questions, it's appropriate to call the office for clarification. Use your notes to prepare for your next appointment too. Track how your concerns change over time, and note any new symptoms or issues that arise. Your notes with these 7 questions are just one part of maximizing your doctor visits. Here's how to prepare for your next appointment to ensure you get the care you deserve. Timing matters. Schedule appointments for when you're most alert, usually earlier in the day for most seniors. Avoid scheduling right after lunch when you might feel tired, and allow extra time so you don't feel rushed. Bring reinforcements. Consider bringing a trusted family member or friend to your appointment. They can help you remember questions, take notes, and provide emotional support. 2 sets of ears are better than 1. Quick question for our viewers. Do you usually go to doctor appointments alone, or do you bring someone with you? Let us know in the comments along with your age and location. Gather your information beforehand. Update your medication list. Write down any new symptoms or concerns, and note any changes in your health since your last visit. Include dates when possible. "I've been having headaches for about 2 weeks" is more helpful than "I've been having headaches lately." Add to your preparation notes. Prepare for common questions your doctor might ask. How's your appetite? How's your sleep? Any falls or near falls? Any changes in your mood or memory? Any new pain or symptoms? Don't save the most important question for last. Lead with your biggest concern, so there's time to address it properly. If you have multiple concerns, prioritize them and let your doctor know what's most important to you. Plan your follow-up. Before leaving, make sure you understand next steps. Do you need to schedule another appointment? Are there test results to follow up on? Should you call if certain symptoms occur? Finally, advocate for yourself. If you feel your concerns aren't being addressed, speak up. You now have 7 powerful questions that can transform your healthcare experience and help you get the personalized care you deserve after 65. Let's recap these game-changing questions. What are your biggest health risks? Are all your medications necessary? What screenings should you be getting? How can you maintain independence? What symptoms should you never ignore? How will treatments affect your quality of life? And what are your options if your health declines? Here's what I need from you right now. Tell us in the comments which question surprised you the most. And don't forget to share your city, state, and age group, 60s, 70s, or 80s. This helps us understand our community better and create content that serves you best. If you haven't already, pause this video now and make sure you've written down these questions along with any personal health concerns you want to discuss with your doctor. Take these notes to your next appointment and watch how it changes the conversation. If this video empowered you to take control of your healthcare, please hit that like button. It helps us reach more seniors who need this information. And here's the big ask. Share this video with at least one friend or family member who's over 65. Don't wait. Do it right now while you're thinking about it. Your health is your most valuable asset, and you have more control over it than you might realize. These questions give you the tools to become an active partner in your healthcare, not just a passive recipient. Subscribe to our channel for more empowering, senior-focused health content every Monday, Wednesday, and Friday. We're here to help you age with confidence and take charge of your health. Remember, you're never too old to advocate for better health care. Start asking these questions today.